So let's start with the topic. So under this pectoral region, the competency which is covered is anatomy 9.1, that says describe attachment, nerve supply, action of pectoralis major muscle and minor muscle. So these are the two major muscles of this region. So pectoralis major muscle, as you all can see on the screen, this whole is the pectoralis major muscle. So it is covering the chest wall. Anteriorly it is covering the chest wall. That means it is the muscle of the anterior chest wall. So we say it is a fan shaped muscle because you can see this is the stem of the fan and this whole muscle is fanning from there. So it is a fan shaped muscle that covers the anterior portion and the upper portion of the thorax. Now this muscle, overlying this muscle is a fascia which is called as the pectoralis fascia. Over that there is a mammary gland which is overlying this muscle. So mammary gland is lying on the bed formed by the pectoralis major muscle. So it forms the bed of the mammary gland, and secondly, if you can see, this muscle is fanning towards laterally, and this area is the region of the axilla which is forming the anterior wall of the axilla. So axilla is a hollow form. It is an hollow in which the anterior portion is covered by the pectoralis major muscle. So this anterior wall is formed by the pectoralis major. So pectoralis major also forms the anterior wall of the axilla. So when we will discuss the axilla, this point will again come, that which forms the anterior wall of the axilla. So 2 points, one is the bed of the mammary gland and another is the anterior wall of the axilla, is both formed by the pectoralis major muscle. Now in every muscle we will be discussing about the proximal or origin, proximal attachment. So proximal attachment of this muscle is, it is arising from the clavicle and from the sternum as well as the costal cartilages. So for the clavicle part, if you can see, this is the medial portion of the clavicle from where the fibers are arising and going towards the humerus. So these are the clavicular fibers of the pectoralis major, and rest, these are the sternocostal fibers of the pectoralis major muscles. So we have clavicular head and sternocostal head of the pectoralis major muscle. Now the clavicular head, if you can see, this is the medial portion of the clavicle which is a smaller portion of the pectoralis major muscles. So this smaller portion which is forming the clavicular head is arising from the anterior half of the clavicle, and that too from the medial portion of the clavicle. So here it is very well depicted. This is medial half, anterior surface of the clavicle, giving the origin to the anterior fibers, and that these are the clavicular fibers. Next we will be going to discuss this region of the pectoralis major muscle, that is the sternocostal fibers. Now in the sternocostal head of this muscle we have different fibers. One you can see are the manubrial fibers, then we have the sternocostal fibers and the aponeurotic fibers. So one by one we will be telling you how these fibers take origin from the which portion of the bony parts. First is the manubrial fibers. So as the name is suggesting, manubrial, it is arising from the lateral half of the anterior surface of the manubrium. So this is the manubrium, and this half portion is giving rise to the right side of the manubrial fibers of pectoralis major muscle. Next is the sternal fibers. Now rest of the sternocostal fibers, sternal fibers, if you go downwards from here, these fibers up to the 6th costal cartilage, these are the sternal fibers of the pectoralis major muscle, and costal fibers, they arise from 2nd to 6th cartilage of the 2nd to 6th costal cartilages. Then last is the aponeurotic fibers. So aponeurotic fibers, they are arising from, they take origin from the abdominal part, that is the aponeurotic part of the external oblique. So this is the aponeurosis of the external oblique which is giving the lowermost fibers of the sternocostal part of the pectoralis major muscle. Hope you have understood this part. Clavicular fibers, sternocostal fibers, clavicular fibers from the medial portion of the clavicle, sternocostal fibers from the manubrium, sternum, and the aponeurotic fibers. Then if you see the direction of these fibers, the clavicular fibers, they are directed downwards and laterally. And these sternocostal fibers, they are running upward and laterally. So these all are going up and these all are coming down, and all the fibers are running towards the lateral side. The lateral side is the bone, that is the humerus which is lying. So they have to reach the humerus. So let's see how this insertion of the pectoralis major will take place, starting from the upper to the lower side of the humerus. Now this insertion takes place in a bilaminar shape. This is the bilaminar. So if you dissect out the this pectoralis major at the humerus, you will see the two lamina, anterior lamina and the posterior lamina. So this anterior lamina and the posterior lamina, they are consisting of different fibers. So anterior lamina is composed of the clavicular fibers. So these are the clavicular fibers, and the posterior lamina is the sternocostal and aponeurotic fibers. So one thing is, it is inserting on the lateral lip of the bicipital groove. This is the bicipital groove, this is the lateral lip, this is the medial lip. On the lateral lip we have the pectoralis major insertion, and that too in the bilaminar form. So we have anterior lamina and the posterior lamina. Anterior lamina formed of the clavicular fibers, and the posterior lamina formed of sternocostal and aponeurotic fibers. Now the thing which you have to see is that these bands, that is these two laminas, anterior lamina and the posterior one is bigger than the anterior lamina, as anterior lamina is formed by the clavicular fibers, and these fibers are less as compared to the sternocostal head of the pectoralis major. So this clavicular lamina is logically smaller, and the sternocostal fibers and aponeurotic, they are more, so it is larger in size. So now this is the insertion, how it is taking place, and then we see that these aponeurotic fibers which are inserting on the larger lamina, they go on the upper side to get insert. So these fibers, they get reversed from the lower portion, these fibers will go upside, and the fibers that are coming from manubrium and the sternum, they will go on the lower side. This is a cross formed in the bilaminar insertion. So this is the anterior lamina, posterior lamina, and this is the U-shaped base where these two lamina, they continue to each other. Now this is the tilting of the crossing of the fibers from the aponeurotic, which are reaching the upper side of the bicipital groove, and the sternocostal fibers which are coming downwards. This is called as the twisting of the fibers of the sternocostal muscle. Now this was about the origin and the insertion of the pectoralis major muscle. Now we will be discussing about the nerve supply. So it is very easy to remember the nerve supply. Both the nerves, that is medial pectoral nerve and lateral pectoral nerve, it is going to supply the pectoralis major muscles. So you don't have to be confused between these two nerves, which nerve is going to supply the pectoralis major or not. Now this medial pectoral nerve or lateral pectoral nerve, how it will reach the pectoralis major muscle. So medial pectoral nerve is lying, this pectoralis major is lying over the pectoralis minor muscle. So this will pierce the pectoralis minor muscle, and then it will reach the pectoralis major, while the lateral pectoral nerve will reach the muscle by piercing the clavipectoral fascia, which is lying between the clavicle and the pectoralis minor. Now what are the actions of these muscles? So every muscle has an action. So this whole muscle, if you take the whole amount of muscle, what is the action produced by this muscle is the adduction and medial rotation at the arm. So at the arm we have the medial rotation of the arm. This is how we do the medial rotation, and this is how we do the adduction. So this action is done by the pectoralis major muscle. Now individually the clavicular fibers, they produce the flexion of the arm. So what is flexion of the arm? This is the flexion of the arm. And sternocostal fibers, they will do the extension. This is the flexion and this is the extension, but this extension should be against some resistance. So if there is a rod or you are putting some resistance and then you are trying to extend your arm, then this action is done by the sternocostal fibers of the pectoralis major muscle. Now if you want to test the muscle, like in your clinical side, if the patient comes to you and tells you there is a weakness in the adduction or medial rotation, like he is not able to do some activity, so how you will test this muscle? So we will tell the patient to make a fist and press against each other. So when the person press the fist against each other, the fibers lying over here, they will become contracted. So there will be a rounded contour on both the sides. If you are finding the good anterior axillary fold, that means the muscle is intact. This action is done by the muscle pectoralis major. So you can look for some other reason. Then the clavicular fibers and the sternocostal fibers, how we can test them individually. So clavicular fibers we will be testing. I told you the clavicular fibers, they do the flexion of the arm. So if we do the flexion of the arm, we tell the patient to do the activity, that is hold a stick and try to lift it. So if the patient is able to lift and these fibers they are become prominent, that means the patient is having the right clavicular fibers, that means they are working fine. Then your sternocostal fibers that help in the extension of the arm against resistance. So I will tell the patient to depress the rod. So in this picture, one is the clavicular fibers, other is the sternocostal fiber testing. So I am telling the patient to press it against the load, and then these sternocostal fibers they are becoming prominent. Or I will tell a patient to lift a heavy table. So that is extension against resistance. So if patient is able to do, or that is if the muscle is contracted, you can see, you can feel it very well, then means the sternocostal fibers they are fine. That means there is no injury in the medial pectoral and the lateral pectoral nerves related to pectoralis major. Now the last thing, the congenital absence of this muscle. If there is a congenital absence of this muscle, there is a syndrome which is called as the Poland syndrome. So Poland syndrome is the congenital absence of the entire or a part of pectoralis major. So I will show you a picture that will clear you the things. So here in these two pictures we can see there is no pectoralis major, and here the well developed pectoralis major is present. So it is the unilateral congenital absence of pectoralis major muscle. So in both the pictures you can see on one side the pectoralis major muscle is one side whole of the pectoralis major is not developed, and on one side some portion of the pectoralis major muscle is developed. Both the pictures signify the Poland anomaly or syndrome. So this is very common question asked in your exams. So what is the Poland syndrome, or they show you the picture and ask you what is the diagnosis. So this is all we have discussed in the pectoralis major muscle. So thank you. We will be meeting in the next class.